Spend enough time around Alan Sarvin, and you'll learn he knows pain.
Fractured my neck twice on the left side, so I've got restricted movement. I've broken ribs, fingers, dislocated my right shoulder, separated my left.
Pain that Alan, better known by his ring name, Al Snow, grapples with daily, the collateral of a 41-year professional wrestling career.
Broke my ankle, I've cracked my tailbone, I've dislocated my hip, tore my groin. I could go on.
Al and his mannequin partner named Head climbed to fame in the early 2000s, an embodiment of World Wrestling Entertainment's Attitude Era, putting his body on the line night in and night out.
The wonderful, amazing thing about the human body is that it adapts. No matter what stress or duress, physically, mentally, or emotionally you put it under, it can and will always adapt.
But there was pain Al couldn't wrestle with any longer. The constant bone-on-bone rubbing in both his knees, osteoarthritis.
I had lived in such misery, I mean truly, genuinely miserable. My knees were bone on bone, there was nothing left. They were so arthritic, and I literally had bone spurs that were developing, and if you were to run your hands across like the tops of my knees right here, where your quads intersect into the actual knee joint, and on the sides too, you could feel knots.
Bad enough for the man to seek the help his wrestling persona so often depicted he needed. In 2020, Al went to see Dr. Jeffrey Stimac at Norton Orthopedic Institute to explore his options. They talked about treatment, and with knee replacement surgery firmly on the table, Al had one request before he put himself through it.
Dr. Stimac was like, "You want to do both of them at the same time?" And he had not heard me right, and I was like, "Yeah." I said, "Let me make this clear. If we don't do them both, I ain't doing it." And he was like, "Well, we can do that. The recovery is going to be, a challenge."
It was a challenge Al was ready for. So in October 2020, Dr. Stimac and his partner, Dr. Kevin Himshoot, tag-teamed Al's surgery, replacing both his knees at the same time.
His expectations were certainly higher. If I'm being honest, preoperatively, I certainly had a little bit of concern whether he was going to be able to get back to that, because with knee replacements and really any joint replacement, there's no guarantee you'll get back to the physical activity level that you had, especially somebody who's a professional wrestler.
Surgery was a success, and despite the concern, Al breezed through physical therapy, weeks of exercises to regain the movement in his knees, a wrestler's determination to push through and get back in the ring.
The one thing I had not been able to do for years was just run. And I amazed myself as I took off, because the adrenaline was going, and I was in front of an audience, and I ran down to the ring, and I was like, got in the ring, like, holy cow, I was able to actually run into the ring. And
in Al's case, he was such an active guy who still wrestled, still lifted weights daily. He was very fit coming into the surgery. I think that helped make his recovery much easier.
Now at age 60, the CEO of Ohio Valley Wrestling isn't in the ring as much anymore, but he is still as present as ever, keeping a watchful eye over the talent during their Thursday night shows, imparting a little knowledge on the new age of entertainers, thankful for a pair of new knees and the surgeons who made them possible.
it is, without a question or a doubt, it is worth every bit of what you will go through to get to the other side. I tell people all the time, honestly, that this is probably one of the best things I've ever done for myself.